Of course, anybody using a hyperbaric chamber is looking to improve their health and to feel better. But some people do feel worse after a chamber session or after a series of chamber sessions. In this video, we're going to cover the top 3 reasons why somebody might feel worse after their hyperbaric oxygen therapy treatment. So if you know anything about hyperbaric oxygen, you understand that this is a time commitment and it's a financial commitment. And so anybody that's really looking to proceed in a hyperbaric protocol is looking to improve their health, or to move away from a certain disease process, or to find relief from certain symptoms, or to improve their performance and reduce their stress. And so certainly nobody wants to feel worse going through a hyperbaric oxygen protocol. However, absolutely, some people do feel worse after their first session or after the first few sessions. Why is that? And so what I would say is, over the past 17 years of operating hyperbaric clinics, I find 3 main reasons that patients feel worse after sessions. And we'll talk about each one in detail, but just to overview, the top 3 reasons are somebody who might already be over-oxidized, oxidatively fragile, if you will, and they go too deep, too quickly in a chamber protocol, and they become over-oxidized. And so they're already sensitive to oxidation. There's additional oxidation from hyperbaric, particularly from higher pressures of hyperbaric, and their sessions are too long and the pressure is too high, and we've just pushed them faster than their body is able to adapt to that level of oxidation. The second is that they feel fatigued after the session. They feel very tired after the session, like wiped out. And to me, when that happens, that's an imbalance in the autonomic nervous system, which we'll talk in more detail what that means. And then the third reason is because someone who has a chronic infection, and as hyperbaric increases their immune system's capacity to fight that infection, and or the high oxygen environment is actually helping to act as an antimicrobial agent, killing the infection. And as that infection dies, there's die-off occurring inside that person's body. Toxins are being released inside that person's body, and ultimately they end up having a Herxheimer reaction. There are likely to be a few other reasons than the top 3 that I'm naming, but ultimately it's really not common to have somebody feel worse after their session. And so we're talking about a pretty small population size. And in that small population size, these are really the top 3 categories that I would say most of those people would fall into. Often we can identify who those people are going to be even before their first session. So if we pay close attention to that, we could either predict that they're going to have that experience to let them know that they might start to feel certain symptoms more in the beginning, but that they'll turn the corner and they'll ultimately get better. Or we can shift their protocol and just be more gentle in the beginning and allow more time to build up to higher pressures if that's what they need, but letting them adapt to the oxidation, and so that they have a better experience in your office going through that program of care. So let's just take them one at a time. The over-oxidized patient. This patient already knows that they're sensitive to EMFs, they're sensitive to radiation. This person may have multiple autoimmune diseases. This person may have also some autonomic imbalance, like the second category of people. So chronic fatigue or fibromyalgia. Their inflammatory levels are very, very high, and they're very sensitive to other supplements and other therapies that they may have tried in the past. When we have a patient like this, putting them at 2.5 atmospheres on 100% oxygen for 90 minutes on their first session is likely going to backfire. What's the rush? If we start a little slower and we expose them to small amounts of hyperbaric, small amounts of oxidation, and we give their body a chance to recover and recuperate from that, rebuilding their body's antioxidant system. We've done a number of videos on reactive oxygen species and hyperbaric, so if you haven't seen those, please take a look. But if we expose this person over a series of treatments to slowly increasing levels of hyperbaric, which also means slowly increasing levels of oxidation, not only will they tolerate our treatments better, but they're actually going to tolerate their environment better. And so by taking our time, we can have them have a really good, positive, healthy experience with their hyperbaric protocol. Within that first category, if you're pushing too hard, how do you know? I think the best way to explain it would be, it's not that it's creating new symptoms that that patient has never had. It's actually that we're just aggravating current symptomatology. Issues or symptoms that they either currently have become increase in intensity, or older symptoms that they used to have start to resurface a little bit. That would be a really good indication that we're pushing too hard. In some cases, and with some patients, you have to know your audience. It's okay to push through that. You know what the benefits are on the other side. And so if you do that slowly and safely, that's a clinical decision that you would have to make in your office. I'm not saying that's the wrong thing to do, but prefacing and setting an expectation like that with your patient would be really important. A lot of those patients don't want to be pushed that hard. They'd rather go slower and feel better throughout the journey. But sometimes they want to be pushed. And again, you have to know who you're talking to, who you're working with, and what the best course of action would be for that person. Within the second category of the autonomic nervous system, these people typically don't feel worse from a symptom standpoint. They feel really fatigued. They feel wiped out. Like they get out of the chamber and they're like, I need to go home and go to sleep. I believe that most of these patients are very sympathetic driven patients. They live in fight or flight. They live in their sympathetic nervous system. Hyperbaric has a very parasympathetic effect on the body. In most cases, that's terrific. Most people need to be brought back into their parasympathetic nervous system. In our parasympathetics, we digest our food better, we sleep better, and then we heal and regenerate tissue more effectively. And so the parasympathetic nervous system is critically important, and so many people are deficient on that side of their nervous system. When you take a patient who's very, very sympathetic nervous system driven, and you bring them back into their parasympathetics, usually they feel exhausted. Now, it's easy for me to say, I think that's a good thing. We're helping to teach that person's body how to operate within the parasympathetic nervous system again. But in those first few sessions, that might feel exhausting. Similar to the first category, perhaps we just want to go slower, build up their amount of time, their frequency, their duration, and their pressure over a series of treatments so that we're not pushing too hard on their nervous system. Or again, if you know your audience well, you can push these people a little harder because it's typically less difficult and faster to push through some of that fatigue than it would be to push through an overoxidized patient. Again, that's very important to know each patient individually and then have these conversations so that they understand. Listen, the reason that you're tired is likely because this chamber is helping to center your nervous system. It's helping to bring you back into your parasympathetics. It's helping shift your nervous system back into the rest and digest, the heal and recover portion of your nervous system, which right now you really need. But again, we have to have those conversations and set the expectations properly. The third category is that chronic infection patient, where as we apply hyperbaric, both because of the high oxygen environment being an antimicrobial agent, helping to kill the infection, as well as the well-known benefits of hyperbaric oxygen increasing our immune system's capacity to fight infection, we start to get a die-off reaction inside that patient. As we're killing the infection, those infections are releasing toxins and patients can have an Herxheimer or a Herx reaction from that. Similar to the overoxidized patient, that doesn't usually create a whole new series of unexplained symptoms. It's typically a re-exacerbation of symptoms that patient either already has, but now it's magnifying, or old symptoms that they used to have that are resurfacing. Similar to the other cases that we were just talking about, this could be resolved by just going slowly through a transition of therapy, slowly increasing their frequency, slowly increasing their duration, and slowly increasing their pressure so that they're adapting and adjusting to those increased levels of oxygen, so that the speed to which the immune system is improving slows down a little bit. The speed to which the oxygen-rich environment is suppressing those infections slows down a little bit. If we do that slowly and thoughtfully, we can help that patient transition through a series of treatments, improving their immune system function, reducing their microbial load, and ultimately improving their health over time. Similar to the other two cases, you may get the occasional patient that knows what a Herxheimer reaction is willing to tolerate it, and wants to push through it because they know what's on the other side. In those cases, I think it's appropriate to do that as long as you have the conversation, the patient understands the expectations, and you have an open dialogue to understand how that patient is going through their care, how they're tolerating it, being able to back off if need be, and push harder if you can. But again, patient expectations really important. These are all long-term patient relationships. If we break the trust with our patients, if we push them harder than they're willing or wanting to go, and we break that trust, we're going to have a hard time making sure that they stay long enough to actually get where they're trying to go from a health perspective. Honoring that trust and having open dialogues and those conversations with patients so that they understand what their choices are, what they're feeling and why they're feeling it, and what the best ways to proceed are going to be, establishes stronger rapport, stronger trust with that patient, and increases the chances that they'll stay with you long enough to get to the results that you and they both want. So these are the top 3 categories of why some people do feel worse after a treatment. Again, typically that's not a long-lasting issue. That's a short-term issue. It's usually the first session, the first 3 sessions, maybe the first 5 sessions. But if you do it the way we discussed and transition people through an increasingly intense course of care up to that patient's tolerance, you should be able to get the results that both of you want and to do it in a way that that patient feels good through the journey. Thanks for listening, and we'll see you on the next video. So whether you're a chiropractor or a naturopath or an acupuncturist or a DO or even an MD, but you're looking at hyperbarics through this lens, the lens that I'm describing, which is applying hyperbarics for all these off-label conditions, this is the class that teaches that. And right now it's the only class that teaches this type of hyperbarics in this way, and that's an actual certification course. Check out hbotusa.com, and right across the top you'll see upcoming events. You can click on that and it'll show you when our next courses are going to be.